With spring in full swing, we're hearing many people complaining about sniffling, sneezing, and coughing, and nearly 1 in every 6 Americans suffer with some sort of seasonal allergies, the most common being pollen. Well, Dr. Jacqueline Squire, an allergist with the Mayo Clinic, joins us now. Thank you so much for joining us this morning.
Thank you. It's a pleasure to be here.
First, can you tell us a very simple question? What is an allergy? And can you tell us the difference between allergies and a cold?
Yes, so an allergy is basically just a strong immune response to normal environmental things that we come into contact with. Most commonly, that's going to be inhalant allergies, things like pollen and dust that we come into contact with. Now, with a cold, even though we call it hay fever, a fever really is not a common symptom of an allergy. So if you have a fever, that's more likely to be a cold or a virus. Also, if you have symptoms like muscle aches or chills, that's going to be more often associated with a cold and not really an allergy.
What are the common allergy symptoms?
So allergy symptoms that you can have include nasal congestion, sneezing, itchy and runny nose. You also can have itchy and watery eyes. Some people will also have symptoms of itchy ears or in the back of the throat. Sometimes that can be from an allergy as well. If you have asthma, that might lead to having an asthma flare with a cough or some chest tightness, maybe even some wheezing that you can see when you're exposed to your allergies.
And when we're talking about spring allergies, how do you cope with them? What are some suggestions you have to reduce reactions?
Yes, really our first line with any allergy is to try to reduce your exposure, which is really hard this time of year. The weather's beautiful. We want to be outside, and that's when you're going to get most of your exposure. So first things that we recommend are to actually reduce the amount that you're coming into contact with. You can do that by actually keeping the windows closed in your home or the windows rolled up in the car when you're riding around. Keeping the air conditioning on does help as well because that's going to filter the air. That little recirculate air button in the car, that can be helpful as well. If you do have to spend time outdoors, try to limit it during those times when it's really peak, allergy season, allergy times. Often the local news will report that for you when it's the peak season. And then if you do go outdoors, do spend some time when you come in, go ahead and change your clothes and even take a shower would be very helpful to rinse all those allergens off of you.
And there are so many options for over-the-counter medicines. I know I get confused. Do I get Zyrtec, Claritin, drowsy, non-drowsy? What is your advice for figuring out the best medication to treat the allergies?
You are completely correct. It's overwhelming when you walk in and there are so many options. And within each group of medications, there's multiple options. Now, in general, from an allergist standpoint, we don't recommend one particular medication over another. They're all very good. And it really just depends on each patient's personal preference and what seems to work best for them. So it is okay to try different options. Usually you want to give each medication that you try at least a couple of weeks so you can really see the full benefit of it though. So first line, I will typically recommend something like an oral antihistamine, which as you mentioned is the Zyrtecs, Claritins, Allegras. Those things are going to really kind of help work with sneezing and itchy nose. And you can take those either as needed. So if you don't have symptoms all the time, just here and there, or you can take them daily during your allergy season. Benadryl is similar, but in general, we actually tend to like things like Zyrtec or Claritin a little bit better because, as you mentioned, they're non-drowsy and they don't really have that kind of side effect that Benadryl can have sometimes, though certainly can use Benadryl sparingly. The next medication I always recommend, especially if you have nasal congestion, lots of runny nose, is going to be an intranasal steroid. That's something like Flonase or Nasacort. Now, these medications really do work best when you use them daily, though. So if you are going to start a nasal steroid, I recommend using it daily and using it for up to 2 weeks or at least 2 weeks to really kind of see the full benefit and the full effectiveness of it. Additional over-the-counter medications include things like eye drops that contain an antihistamine. If you've got itchy, watery eyes, that's a good option to add. There are also nasal decongestants, but we recommend using those very sparingly and not using them for more than a couple days in a row.
All right, well, this is all such helpful information. I know I'm going to be keeping these in mind because my allergies have been through the roof this past week. Thank you so much, Dr. Squire, for joining us this morning.
You're welcome. Have a great day.